Hello everyone, and welcome back. Today I will be giving Lecture 3 in our 4-part series on mental health and aging in rural areas. My name is Morgan Stengel, and I am a second-year social work PhD student here at the University of Iowa. I am currently working with Dr. Nadia Saba-Steinberg on this lecture series, and I'm very excited to be talking about this third lecture in our series pertaining to mentation, social isolation, social networks, belonging, and resiliency. And this all will tie into our overall theme of looking at older adults living in rural areas and how they experience mental health. We'll also have recommendations at the end, which will include recommendations based on the topics that we discuss in this lecture. In our previous lectures, we had talked about what matters to older adults, what do they value in their mental health care. We also briefly mentioned medication in Lecture 2 and how primary care providers can help with mental health care through medication. In this lecture, we will be discussing mentation, which in the 4M's framework is to how to prevent, identify, treat dementia, delirium, or depression. In this lecture, we'll be discussing more about mental illnesses such as depression and anxiety in terms of mentation. And in particular, we'll be talking about isolation and loneliness, belonging, resiliency, all its role on mental health. So first, we can talk about isolation and loneliness, and what is the difference? Loneliness is the pain that someone feels when social connections do not meet an individual's need. But social isolation is the state of having a smaller number of social contacts, which may contribute to loneliness. And we can think about this for older adults living in rural areas. Of course, for older adults, as they age, they may experience more social isolation as their social networks may become smaller. Older adults living in rural areas as well may have more distance in their social networks compared to older adults living in urban areas. However, nearly half of the older adults in the United States experience some degree of loneliness, with about 19% feeling relatively frequent loneliness and about 29% of older adults who experience occasional loneliness. And so what can contribute to feeling isolated, which in turn affects loneliness? As individuals age, social consequences of impairments and diagnosis can affect their quality of life and increase social isolation. It may be, say, more embarrassing if vision and hearing deteriorate, urine function is affected, mobility problems, and poor communication may be socially stigmatizing. This is another factor for older adults. As they age, they may experience different changes in their body that they may feel is more stigmatizing in their social circles, and they may not want to be talking about this in their social networks because of that stigma. We can also think about COVID-19, of course, and having more social exposure lately for older adults can mean more risk to contract COVID. So this can also contribute to feeling isolated, and also for older adults living in rural areas. Older rural adults comprise a large and increasing percentage of the population in the United States. As of 2014, more than 16% of the population aged 65 years and older were categorized as living in rural settings by the U.S. Census Bureau. The proportion of older adults in rural areas has grown rapidly due to aging in place, retirement transitions, and outmigration of younger families. So having these social networks for this increasing population of older adults living in rural areas, these social networks are incredibly important. However, having these more remote and sparsely populated areas may increase to more feelings of loneliness or isolation. It is well known that most older adults would prefer to age in their homes and communities, but these older residents may be living in the most remote areas, and they may be also far from healthcare and social services, and even social venues such as maybe a senior center, a restaurant where they can meet with their friends. Therefore, they have more distance to these types of ways to access social networks. Transportation is often a frequent barrier for older adults who live in smaller towns, in rural areas. Additionally, transportation is frequently lacking, and traveling to larger towns and cities where necessities, including healthcare, are located can be difficult for older adults living in rural areas. Therefore, the inclusion of social support in mental health interventions may also serve in mental health care access and improve outcomes among older individuals facing mental health challenges. While these collaborative care models have shown success for improving mental health care outcomes, such as integrated healthcare, modifications of these models to include peer specialists to assist with transportation and delivery of basic interventions have shown success in improving access to care within small practices, such as found in those in rural areas. And this also briefly touches on our lecture 2 with primary care providers and how primary care providers can improve access to mental health care services. Social networks consisting of family and friends tend to better facilitate older adults' emotional well-being than networks consisting of only family or only friends. And both family social networks and mental health status are important predictors of resilience among these individuals, which are older adults living in rural areas. These two quotes here indicate that having a strong social network comprised of both family and friends can help mental health status and also can help predict resilience among older adults. And we'll be talking a little bit more about resilience and how that can assist with mental health. So, social support, emotional well-being, how is this tied together? So having more community, like friends or family, can improve mental well-being for older adults. Compared to participants who lived with others in this study in 2021 by Ashita, which we saw on the previous slide, older adults who lived alone reported more depressive symptoms and higher frequency of feeling lonely. Those who lived alone also had higher proportion of local friends in their networks than those that lived with others. So by providing supportive infrastructure for community-based older adults to develop co-engaging relationships with local friends may be beneficial. Therefore, having those social network approaches can be used to identify the existing network members who want to help play in this role of providing supportive infrastructure. And having more members who co-engage in activities in a social network, this was associated with lower depressive symptoms. So now that we're talking about resilience in social networks and mental health for older adults living in rural areas, these two quotes from McKibben et al. In 2016 found that family social networks and mental health status are predictors of resilience among older adults living in these rural areas. Having the inclusion of social support in mental health interventions may also serve in mental health access and improve outcomes among older individuals facing mental health challenges. So having that social support play a role in mental health care for older adults may also help their mental health outcomes. We've briefly talked about how what matters to older adults, they value their social relationships, their family, their friends, their primary care providers. So having that influence of their values of wanting support from their social support network can improve their mental health outcomes. And then if we're talking about psychological distress and how resiliency and social support can help reduce psychological distress, protect against psychological distress, we can look at the associations between psychological distress and physical impairments. Were somewhat reduced when adjusted for social support, particularly for hearing, whereas the associations between somatic diagnoses and psychological distress were more or less eliminated. So one explanation for older adults feeling more isolated, more lonely, is that there's these practical and social consequences of impairments and diagnoses. So this could be problems with balance, hearing, vision changes, urine function, and memory. These can all cause poor communication, can decrease information flow between this older adult and their loved ones, and it also can increase mobility problems. These are all factors that are socially stigmatizing and are often connected, of course, with aging and also with mental decline. So having this social support piece, like in this quote, it can help reduce the psychological distress older adults feel when they encounter, changes, their poor communication from these changes, things like that. And this also is from that same article, and it shows that social support is moderating the effects of psychological distress and somatic health problems. So having more somatic health problems, that could increase psychological distress. But having that social support act in between the two can help decrease psychological distress. Now that we've talked about isolation and loneliness, we can talk about belonging and connectedness. Now that we've talked about the role social support can help in lowering psychological distress and how social support can improve mental health outcomes. Social connectedness isn't always easy to measure, especially among older adults and older adults living in rural areas. Therefore, we can look at these 9 factors to look at for older adults living in rural areas in particular, and how this can indicate social isolation and where can intervention be inserted to improve belonging and improve connectedness. So we have living alone, which of course is one of the most simplest indicators. Many older adults may end up living alone, especially in rural areas. There may be more distance. Having a small social network, like we talked about, having a social network comprised of family and friends is usually better than just having one or the other. Having infrequent contact with their network is the other way to look at this. So having regular contact with social network can improve belonging and connectedness. There's also that perceived lack of support. And those perceptions that older adults have can really also affect their sense of belonging, their sense of being connected to their family, their friends, their community. Also, the low participation in social activities. In rural areas, of course, there may be more distance to get to these social activities, perhaps to the local diner, to the local senior center, some sort of the library, perhaps. Anywhere that they can gather with their social network can also help improve their belonging and connectedness. And of course, the feeling of loneliness or not belonging to perceptions, the feelings older adults are having, these can also, of course, affect their mental health. And having that social support to intervene can improve their mental health outcomes. And the recommendations for this, we can look at faith-based organizations to help create social connections. These faith-based organizations can be very helpful for older adults living in rural areas. They may be very connected to their religious community. Social media is a new way to improve feelings of belonging and connectedness for older adults. Perhaps they've started using Facebook, texting their family, FaceTiming their family and friends, things like that. How can we use social media to help improve their social connections? Also, social media can be used to advertise social activities, be used to advertise mental health resources, provide mental health resources directly, increase that awareness and knowledge for older adults. We can also focus on interventions directly addressing companionship, such as letter writing, pen pal programs between K through 12 grade school children and older adults. We also could provide animatronic pets in the home and also visits from students as part of professional training. This could be nursing students, social work students. Anyway, these colleges could connect and create those more connections for these older adults could be very helpful. And finally, how can we include social networks and support in mental health care treatments and planning? And how can we also utilize older adult social networks and their communities as resources for mental health care and support? So primary care providers, or PCPs, they could be able to talk to this older adult who may have mental health concerns and ask, is it okay if we bring your family to talk about these concerns as well? Or is there someone you want to talk to also, aside from me, that we can bring in and help improve your social network? And also provide information on how social networks themselves are beneficial for mental health for older adults. And also, how can we bring in these social networks and help empower them and the older adult in their life to come together and start talking about mental health care concerns or just mental health in general by increasing that piece of awareness of reducing stigma and promoting the dignity of older adults through their social network by normalizing mental health care concerns, normalizing mental health issues, normalizing seeking counseling perhaps or mental health care services. Through this normalization process, through the entire social network, this could also improve the support the older adult feels. So overall, it's very important to think about social networks and support in the role of mental health care and how it can play in the role of mentation, which we talked about previously for older adults, which is that mental health piece of anxiety and depression. And now we've reached the end of Lecture 3, and I'll briefly touch upon what is in store for you if you go into Lecture 4. Lecture 4 will be pulling in the last piece of the 4 M's, which is mobility, and we'll be talking also about social networks in terms of accessing services, in terms of being mobile to get to those services. We'll also be talking about the physical barriers to mental health care, such as distance, transportation, and income, and how can we discuss mobility in terms of these barriers to get to mental health care for older adults. So we'll be bringing in more about social networks. So if you're very curious about social networks and the potential they have for mental health care and mental health overall for older adults living in rural areas, that'll be a good lecture for you. So thank you all to everyone for coming today, and I hope to see you in the next one.